you just kind of explain what Sirva is?
You bet. So Sirva stands for shoulder injury related to vaccine administration. What that is it can also known as vaccination-related shoulder dysfunction. So the two terms are similar, but they're different. You know, if a bee stings your finger, is your finger injured or does it just hurt? Well, it kind of is injured and it kind of hurts. I would like all of you to understand that now that we have a way to get rid of this. I'm not even wanting to call it an injury so much, but just dysfunction or a condition or a complication. But anyway, whatever we call it, whether we call it Sirva, shoulder injury related vaccine administration, whether we call it vaccination related shoulder dysfunction or chronic shoulder pain after vaccination, we believe that this is caused by the vaccine going too high and too deep in the shoulder. That's through the deltoid muscle right here. And I'll show you with this model here. This is a model that has a shoulder, and this is the deltoid muscle right here. That's the same as my arm right here. And see, underneath the deltoid muscle here is the rotator cuff. That's all this. And so if you give the vaccination right here in the middle, it's just going to be in the meat of the muscle. If it goes up here a little too high, it's going to go into these tendons. Because the tendon, you see how thin it is at the top? This muscle is really thin at the top right here, right there, compared to here where it's this thick right here. So it gets thin right here and it's thick right here. So this is where it's supposed to go. The shot's supposed to go here, but if it goes up here, it's thinner, and underneath it is a rotator cuff. Now, the vaccine's supposed to go into the muscle. The muscle is red. The reason it's red is because it's full of blood. And the blood is what takes up the vaccine, and it's distributed throughout your whole body. And then your immune system recognizes that this is something foreign, and it makes special antibodies that are designed to fight an infection should one come in the future. So it's training. Your immune system is being trained by the vaccine to recognize a virus should it come in. And then it also, the vaccine makes your immune system develop special strategies to fight it. So it'd be kind of like if you had two bad guys who wanted to rob you in the back alley somewhere, and one comes in with a knife and the other one comes in with a gun, and they're standing there, and then you come in and you're like really smart and you go boom boom like a karate, and you bump their heads together and slam them down. That's how it is in the movies. But imagine if in reality you could do that every time you said two bad guys. And that's how it is with the immune system. The immune system recognizes that these two bad guys or whatever the virus is, and it trains. And then when these guys come in, that's what it can do. It can attack and neutralize this virus. But if you don't get a vaccine, then you don't get that training. Then it's just like you've never trained before and two bad guys come up and you go, oh my God. And maybe you try to run for it, or maybe you struggle with them. But when you have a vaccine, it trains your immune system. And that's what it does when it goes in the muscle, it gets sucked in throughout the body. But if it ends up in the tendon here, you know what? You see how that's all white in there? There's no blood supply. And so the blood supply is very poor. So now the vaccine gets stuck in there and it can't get out. And now your immune system recognizes that something's going on, and the immune system sends some cells in there via the slow route, because there are some ways that they can get in there. And now the immune system attacks that virus in there, thinking, it's not the virus, it's the vaccine. It attacks the vaccine, thinking that there's a viral infection there. It's just attacking, and then it just causes pain there, and it doesn't get out. So that's how we think this happens. And you know, I think in some people it just dies down and it goes away. But in others, it just continues and continues and continues for years. And that's Sirva, shoulder injury related vaccine administration, is if you have a problem for many months. The definition in the legal system is 6 months. Is that correct, Daniel? It has to be 6 months to file a claim with at least with the National Vaccine Injury Compensation Program. But anyway, in my mind, if it's gone on for more than a month, it's probably Sirva. I like to call it vaccination-related shoulder dysfunction because I believe it's reversible now. It's not like, oh my God, it's an injury, like I'm never going to recover from this, but it is reversible. But for 10, 12 years, it was not reversible. We didn't have a cure for it. We could just treat it with some cortisone shots. And also, many people got shoulder surgery and they got better. But now, in retrospect, the reason they got better is because when you do arthroscopic surgery, you put a lot of fluid in there. It's washing. So basically, you get to wash out some of those areas. But sometimes that fluid doesn't get quite to the area where the vaccine is. And that's where our technique comes in, where we find it and we wash it specifically in that area where it's deposited.
So, doctor, if you believe you have Sirva, and let's say it is within that first few weeks or months, what advice would you give to someone who is suspicious that this is something that's going on? They obviously are going to have some pain in an injection site, but let's say, like, at what point would you say, is it a week, 2 weeks, 3 weeks? Like, can you kind of walk us through?
I would go back to whoever provided the vaccine. And, I think you don't want to antagonize them, because then they're going to put up their defenses and try to deny it and say it doesn't exist or whatever. Basically, you just say, listen, you're a nice person. You're great. I appreciate what you've done for me. But, I've had this pain ever since this shot. And I heard about this condition. It's called Sirva. And once in a while, the vaccine goes into the rotator cuff. And it can happen to anyone because the needles that we use are 1 inch. And the distance between the skin and the rotator cuff is only a ½ an inch. And so I'm really concerned. I have Sirva, and I'm hoping you can order an MRI for me. And then you can, send them a link to our website, or send them a link to the video that we had on our research website. And they can look at it, and they can look up the articles, and they should order an MRI, because the MRI might show up. Oftentimes it shows up edema, meaning like swelling or inflammation or increased blood flowing in an area where it shouldn't be. And it's typically right back here in this spot on the teres minor or the infraspinatus tendon. And that's not known right now. That hasn't been published. We have one paper that we published, 2 cases with teres minor, but when hopefully this paper that I'm writing right now gets accepted and published, in all 5 cases, it was always in the same spot, the teres minor and the infraspinatus. Those are 2 tendons that are right there when your hand is in your lap. And that's what we find. So that would be the thing, get the MRI. The second thing is have them refer you to a sports medicine specialist who does ultrasound. So that would be family practice, sports medicine, general practice, orthopedic surgery who does ultrasound. A lot of orthopedic surgeons, their tool is the scope, the camera that you put inside. They don't really do the camera on the outside, which is the ultrasound. They just either do the MRI, and if the MRI doesn't show where it is, then you go in with the cameras on the inside, you look around. But there's a group of doctors who don't do surgery so much, but they're focused on having the camera on the outside, and it's very interactive in comparison to an MRI. An MRI, you just lie there and you don't know what's wrong and what's causing pain. You can look at lots of stuff, but you don't know. It's kind of like looking at a parking lot of cars, and you don't know which of these cars has a check engine light on. You don't know which one has some issues just by looking at them on the outside. Same with an MRI. You can look at MRI and you don't know which of those things that you're looking at is causing the pain. But with the ultrasound, it's interactive. We're scanning, we're looking, and then while we're looking, we say, does it hurt right here? And we push on it. And then does it hurt right here? And then we go back and forth. And we can find that spot where it hurts the most. When we find that spot, then we numb it up. If we numb it up and all of a sudden the patient says, oh my God, I feel great, that means we found the spot. So that's the process that we use. But you have to get referred to someone that does ultrasound of the shoulder. So you get your MRI first. Second, you get the ultrasound, somebody who does ultrasound of the shoulder, and they do a good job with it. And that would be the second thing. The third thing is to consider some cortisone shots. Now, in general, I'm against cortisone shots because we have things that are much better now. They're called biologics. So we're using our own body cells instead of cortisone, which we've used for 50 years. We've used cortisone. But now we have something much better than cortisone. We use our own cells to repair little tears and things like that. And we inject those cells to repair those things, to try to repair them or try to get them to heal on their own, to encourage them to heal on their own. But in this case, because it's an immune response and it's the vaccine, it's like an autoimmune response. Your immune system is attacking your rotator cuff because it thinks that there's something attacking you and it wants to kill it. So your immune system is attacking it. So you put cortisone in there and it shuts down the immune response in that location. So it is possible to consider a cortisone shot to that area. It can be in the bursa. It can be in the joint space, especially if people get frozen shoulder, which is very common after this problem. 50% of people get frozen shoulder. Then putting the cortisone in the joint space. So you can put cortisone in 3 different spots: the biceps tendon, the joint space, and the bursa. The subacromial space is the same as the bursa. And those 3 spots, in our first 2 patients, the first 2 patients that I described in 2007, that was enough to get rid of the problem. And that would be, those are the steps. Now, if you've done all that and you've given it time and it's still hurting, then the procedure, the new procedure that we've developed just in the last year and a half is something that would help. Or arthroscopic surgery, but it would have to be very precisely known where is the problem and so on.
And we'll get to that in a second. I have a couple of questions that came up. A lot of people emailed me too that I want to ask you just
Sure.
before we jump there. But a lot of people wanted to know, if you're getting a flu vaccine or a COVID vaccine and you end up getting Sirva, is the vaccine still effective that you received?
Great spot. I don't think we have an answer to that. I believe that it's 50% effective for that dose because some of it is still stuck in there and some of it leaked out and went into your body. So I would say it's a 50% dose. So I would definitely plan on getting second shot or a booster.
Okay. Does Sirva ever go away on its own?
Yeah, we have cases that go away on its own. Well, you know that many vaccines, they lose their effect over time. Like tetanus has to be repeated every 10 years. You just lose the effect of the vaccine. And so over time, it can go away on its own in people. And I've had a number of people who have had mild cases and they just got better on their own. And I think that this actually happens, like the vaccine goes into that wrong spot, probably 1 out of maybe 50 or 100 patients probably, just because, my specialty is going into very delicate places in the body, injections. The person I just did, I was in the neck here, injecting the discs in the neck, and that's dangerous because there's arteries that go to the brain and the spinal cord is right there. So if you miss, it's very bad. So I remember looking at shoulders and thinking, well, nobody taught me how to do a vaccination in med school. We just did it. It's like you just, oh, here's a muscle, stick it in here. But now there's a lot more formal training. People realize you should do 3 finger breaths below, and I recommend 4 finger breaths below the acromion to be perfectly safe. But the bottom line is that it's easy to go too deep, and it's easy to miss and go into that rotator cuff. And I think it happens much more often, but not that many people get this problem because it's 1 at about 10,000 vaccinations. So over a course of 300 million vaccinations, 1 out of 10,000 comes out to 30,000 people. That's like a small town, all of whom have Sirva. But 1/10,000th of 300 million is 30,000 people. So that's a lot of people. But then again, only 1 out of 10,000 people that get vaccinations are going to get this. So if you've had this, you're one of the unlucky ones. And I think there's genetic and there are other factors that go into it. So I think it does happen more often than we think. And, but many people get better, but some people go on, unfortunately, to have ongoing pain.
And you touched on what was going to be one of my next questions. Is there anything you guys have seen as far as data as to who's more susceptible, like whether it's, sex, age, race, anything like that? Or does it just seem to be, or at least are we too early on to kind of see anything that's, or children was one of my other questions. Have you ever seen a child with it?
Right. So the first question is sex, age, and so forth. It tends to affect women more than men. So, and we can see from the audience, there are more women than men. It tends to, I'm assuming that some of you have had this, but yeah, 4 to 5 patients are women. Don't know why. Maybe women do have a more of an autoimmune tendency. Like women will have more immune reactivity to things sometimes. and like things like rheumatoid arthritis, which is your immune system attacks yourself. And we think some of these autoimmune diseases like rheumatoid arthritis can come from even household exposures like certain bacteria in the mouth and so on, and trigger your immune system attack itself. So women, yes. Children, no. And that's been a puzzle. Like, why is it that children don't get it? And I have two reasons. One is that children often get it in the thigh. And number two is that in children, the rotator cuff still has a pretty good blood supply. Babies and children, some of the things that as an adult, the blood supply, kind of disappears, and that's normal. But in children, they have like persistent blood supply from the time that you're a fetus. Many of these structures like discs and these other tendon structures and ligaments have more of a blood supply when you're a child. So that's why if they got it there, their blood would just wash it away and it would clean it up.
This is another question that came up a lot that people email me. What should I do if my doctor says, I've never heard of Sirva or I think it's, I don't believe in Sirva. What would you tell the people to do that?
I would just go to PubMed. You can get a computer like any portable computers. And I don't know if many of you know what PubMed is. PubMed is the National Library of Medicine. And all you have to do is put in the keywords shoulder, injury, vaccination, or Sirva, and a bunch of articles will pop up. And so you can just show them all the articles. You say, yeah, you don't believe in Sirva, but what about all these articles? And or you can take them to some of the websites, or there's a review paper by Martin Arias, a review paper that reviews all the papers on Sirva. So that's a great paper. Forget what the name of the journal was. I could look it up and let you all know. But anyway, so there are definitely review articles, and all I have to do is Google it. So I'm just gonna look up the Martin Arias article. Arias is a 2017 article. It was published in the journal Vaccine, and I can make it available to people right now. So anyway, it's called Risk of Bursitis and Other Injuries and Dysfunctions of the Shoulder Following Vaccinations. It's in the journal Vaccine, 2017, published by the author. He's got a double last name. The first half is Martin, the second half is Arias, Martin Arias. He's from Spain, and his first two initials are LH. So that's in the journal Vaccine. So that's a review article that talks about all the articles on Sirva.
I think that's very helpful. Thank you. All right, so I go to the doctor. I get an ultrasound. I'm still not feeling better. What are the drastic steps? You know what I mean? Like where do we keep going?
You go to your doctor. You get an ultrasound, scan it. Then they should try an injection, subacromial injection with cortisone. They should try an injection with cortisone in the joint, plantar humeral joint. They should try those things. They should try therapy. And you have to look for frozen shoulder. If you have frozen shoulder, if you can't do this, like if you get stuck right here, your shoulder won't go any farther. And even if somebody tries to do it for you and it gets stuck. So this is active is when I'm doing it myself. Passive is somebody tries to do it for me. If your shoulder won't go back like this, if your arm won't go back, that's frozen shoulder. And if you have frozen shoulder, then you need an injection into the middle of the joint or into the front of the joint here. It's something called a rotator interval. That's very effective for that. So that a lot of times that'll improve people's pain and disability by 50% within a couple of days. And it could be permanent improvement just for that spot. So try all those things. And if after doing all those things, if you tried some injections and you're still having trouble, well, then you can contact me.
Well, that was going to be my question. The next question is what?
Or you go to an orthopedic surgeon who is interested in Sirva and recognizes what Sirva is. But you have to be really careful about knowing exactly where the pain is coming from. And most often, at least in 90% of our cases have come to see me, and we're talking about 25 people, not hundreds of people. So right now I've had about 25 people see me in person. And we've had maybe 50 people that I've seen over the internet whose cases I've reviewed as an expert for the government and so on. But in most of these cases, it involves two particular tendons, the teres minor and the infraspinatus. And we think that those two tendons need to be washed out. And if you wash them out, then the vaccine comes out and you're better. Now, in 10% of patients, we weren't able to find out exactly where the vaccine went. And we kept chasing it, looking and trying to find it, and we couldn't find it. And really, it's kind of like, imagine that you have a glass of wine or something, and you're carrying it in your kitchen, you drop it. You know, the glass goes everywhere and the wine goes everywhere. But you know, it's erratic. Every time you drop a glass of wine or drop or something breaks, it spreads in slightly different ways. It can go this way this time, or mostly right in the middle, but it can scatter in many different directions. Same thing when this goes in, when the vaccine goes in this area, it can mostly stay in the infraspinatus and teres minor, but it may spread in unpredictable ways in other areas. And that's where it's kind of hard in some people to try to chase down where all that went. But we're learning more and more about it. And recently, I learned a lot more because I had a patient from Tennessee and he came to see me, and I think he's your client. And I got him 50% better. And then he came back for a second thing. And I was really concerned. I thought, uh-oh, I'm not going to be able to find it. But we did some sleuthing, and we did find that the vaccine had followed the tendon into the muscle. It went from the tendon where it was deposited here, but it went far away in this direction, the muscle. And then I cleaned out the muscle there, and it's all good now. He's all good now. So we're learning more and more.
I will attest that I've seen him hitting golf balls twice in the last week. So.
Oh, fantastic.
Yeah. Dr. Bodor, can you kind of explain what this procedure you came up with is obviously, I mean, revolutionary, or at least not to put words in your mouth, but I've seen firsthand, like you said, I know someone who's a client of mine who has had great results, and I think that there's been generally great results from it. Can you explain what it is, and then maybe when it's time to seek it out?
Yeah, sure. I'm just going to go and get the device. I have the device here. I'm just going to walk over to my other part of my office here. And I have some of my devices in here. Here it is. So this is the device. It looks like a needle. You see this? It's basically like a needle right here, and it's not that big. So we numb it up, and this has a needle inside a needle. And so there's water. You see, there's hoses here. And so there's water that goes in and water that comes out. There's also this black is a little electrical current. The electrical current powers, it's like a jackhammer. So it goes back and forth. It goes, and so that oscillates the tendon, and it's washing it. And so imagine if you have a sweater, a nice white sweater, and you spill ketchup on it, but imagine you can't put it in the laundromat, but you have to use a hose to wash it. You'd sit there with the hose and spray it and spray it and spray it. How much would you have to spray it until all the ketchup came out? Well, a lot, right? So what we do is we end up spraying water into that tendon, and that tendon, the size of the tendon is maybe the tip of my finger, but the amount of water that we put in is about equivalent to this much cup, 200 cc's. And it goes in and out. So we really wash it out. And also there's oscillations that goes back and forth, just like a washing machine. When it oscillates left, right, it causes the water to move around, and it causes the ketchup or whatever, the contamination to fall off the sweater. So that's what we do is first of all, we have to find that spot. And then once we find the spot, and we find it by scanning, by looking at an MRI, by scanning, and by talking to you while we're scanning the shoulder with the ultrasound, we're talking, and we find, is it her here or here? More or less. Go, how about here? How about there? And then, you do it again, and then again. And if you keep identifying that one spot, that's where we numb it up. And then when we numb it up, and if your pain goes away, that means we have pretty good evidence that that's where the vaccine is. But the vaccine is invisible. It's an invisible contaminant. But we have to just suppose it's there. We don't have proof it's there. We have to suppose it's there. So it's either the vaccine or it's the immune response that's stemming from the vaccine that's in there. And then we wash it out. And then many people are sore for a day or two, actually sometimes even for a few weeks. And some people get better as fast as 48 hours. The last patient who came from Portland, Oregon, I don't see her in the audience here, but well, maybe she is here. Anyway, she was very pleased. She was feeling better on the flight home. And so that was one of the fastest recoveries. And we've had also one of my first patients also, she flew in from Massachusetts, and she said for the first time in 2 years, she was able to sleep on Sunday night. We did the procedure on Friday, and Sunday night she was able to sleep through the night and didn't have the pain. But there have been other patients that have gotten better over a period of months, but they definitely got better within a few weeks. So if I get the right spot, it can be as fast as a couple days, but otherwise it can take, up to a few weeks or so.
How long would you recommend that someone go, with other types of treatment before they seek this out? Is there, would you say like, I wouldn't really want to see anyone until in the first 6 months or the first year, or does it have to do with maybe the amount of pain they're feeling?
It depends on how much pain they're in. If you can't sleep and it's inhibiting your ability to sleep and function, well then get it done as soon as possible. If it's sore and you're able to sleep and it's just sore and seems like it's getting a little bit better, it seems like you're making some progress with the cortisone, then you could wait a few months or 6 months or something like that.
And obviously you're in Napa. Some of these people are not even in the United States. Are you aware of anywhere else that is doing this procedure?
No, I'm very inexperienced doing this. I've only done 17, 18 cases.
Okay.
But I'm the most experienced in the world.
Well, that's
so
good.
I mean, you can go, but you'll be the first person that they do. And if they're really careful, I mean, if there's somebody who spends a lot of time with you, if they spend 15, 20 minutes scanning you and spend 15 or 20 minutes talking to you and spend 10 or 15 minutes doing diagnostic blocks, if they spend a half an hour to an hour with you one-on-one, then they're really, that person is really paying a lot of attention to you. And then I would trust them to do this procedure. With my guidance, I can advise via Zoom because I know that they would do a careful job.
And I kind of want to just ask you, let's imagine I'm one of your patients. I'm going to come in for this. I have Sirva. Can you kind of just, I was wondering if you could maybe just provide answers to kind of those basic surgical questions, like, what's the prep going to be like? What's the pain going to be like? What's the recovery, the anesthetic? You know what I mean? Can you kind of tell us what you would tell?
It's really minimally invasive surgery. I mean, you can see how small this device is. It's, just a few millimeters, 2.1 millimeters. So there's no stitch. We make a small incision, just enough so this to pass through. And then at the end, we put a little steri strip on. People have not needed pain medication, just take Tylenol or Advil afterwards. Half of the patients, since we do it at a surgery center, because this device is about $1,000 and it gets thrown away, we don't want you to have to pay for it. So insurance pays for it if it's done in a surgery center. If you're going to get it in a surgery center, you could just get an IV and we give you something to relax you, so you get a spa experience, so you can relax.
And so obviously you're not spending the night in the hospital.
No, not at all. So typically people come in on Thursday afternoon. I see them in the office. We try to find that spot. We find the spot. We don't find it, we can't do the procedure the next day. Or it takes us up to an hour to find the exact location. Once we find it, then the next day, 9 o'clock in the morning or 10 or something like that, we do the procedure. This procedure takes an hour because it takes, 10 or 15 minutes just to get set up, all the equipment to set it up, another 10 minutes to scan it again to find that spot, and then another 10 minutes to numb it up. And then about 10 to 15 minutes, I'm going in there and cleaning it out. And then another 10 minutes to get everything taken off and go to the recovery room. So from start to finish, it's about an hour. And then the recovery room time is just 10 minutes.
Do most people need just one session, or do often they need a second session or a third session? Or
I've only done one extra session on one patient. That was your client in Tennessee.
Okay.
But probably there might be others that I may end up doing it on. And so that's about it. So it's unusual to have a second session.
And I know we're early on here as far as data goes, but is there any medical reason or indication why this wouldn't be a a permanent cure? You know what I mean? It's
Sure. I mean, the reason would be just as we can't find where the vaccine went. If the vaccine went all over the shoulder, that then in that case, we can do this procedure, and then you can have arthroscopic surgery to go in and just look around. And when they're looking around, there's a whole ton of fluid going in there, more than just this. It's like a gallon of fluid goes through it.
sure.
And
I guess what I was asking though is if you have it and you get better, is there any reason to believe why you would ever regress?
no,
Okay.
no, we have no reason to believe that someone would at some point regress after it's washed out and so on. And in our patients, the journal that we submitted to, Helion, it's a British journal or Anglo-American journal. We have a one year follow-up period. So we followed all of our patients 1 year, and none of them had any recurrence or anything like that. They all had, once it was at 1 month, they had reached 95% improvement. So they were all 95% or higher improved. So it wasn't like they're 50% improved or 70% or 30%. Like they're 95, 90 to 100% improved. So it's like you're back. There might be a little bit of residual tightness. And one of my patients had arthroscopic surgery before, and they repaired something that had nothing to do with her, that didn't need to be repaired. And she got tighter after that. So and we saw another patient came just last week, and they were going to operate on something that had nothing to do with her problem. And if they'd done that, she would have been tighter because they would have fixed something that didn't need to be fixed, tightened it, and she would have still had the original problem. So anyway, the bottom line is, people are better. And now that was the first 5 patients, but we've had 17 or 18 since then. And there have been 3 that have not gotten 95% better, but in none of those 3 was able to really nail down exactly where the problem was.
Is there anything that you see in the future as far as stuff that's in development? Or
I'm hoping that we won't have Sirva in the future. That people will just be aware not to go up here. If you just need to here's a bone here called the acromion. If you just have 4 fingers here, you can put 4 fingers here, and you're below that pinky, boom, it's not going to go there. So I'm hoping we just won't have it in the future. And I can go retire in Croatia. So.
All right. Well, I mean, I think most of the questions I had, have been addressed, and I think there's maybe a couple people who have some questions if you have a minute. But is there anything
I'm more than happy to answer any of your questions.